Hi, I'm Helen Bauer, and this is the Heart of Hospice Podcast. The Heart of Hospice Podcast is your source for compassionate and informative discussions about hospice and end-of-life care. I'm a certified hospice and palliative care nurse with over 15 years of experience. Whether you're a caregiver, someone with a serious illness, or you simply need to know more about hospice care, this podcast is for you. Join me as we explore all the aspects of hospice, from the details of caregiving to the emotional and spiritual dimensions of end-of-life journeys. For more resources and to connect with me, visit theheartofhospice.com and find us on Facebook, Instagram, and LinkedIn. Keep listening for today's episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This episode is sponsored by GrandPad. GrandPad is the all-in-one tablet designed especially for senior adults. With GrandPad, you get safe, simple video calling and photo sharing. Users can create a private family network that allows for secure photo and video sharing. The GrandPad utilizes a simple format that allows seniors to enjoy games, music, email, and more. Visit our special GrandPad website designed exclusively for the Heart of Hospice listeners at grandpad.net/THOH. This episode is sponsored by Hospice Navigation Services. When you need information about hospice, Hospice Navigation Services can help. Our team of experienced hospice navigators is here to offer one-on-one consulting sessions by phone or video. You can book a complimentary 30-minute session when you need general information, or book a 60-minute session when you have in-depth questions or need to troubleshoot your current hospice care. It's your journey. Hospice Navigation Services can be your guide. Visit theheartofhospice.com to schedule your hospice navigation session today.
Hospice social worker Lisa Pahl is with me today, and we're getting back to the basics of hospice, talking about who's on the hospice interdisciplinary team and what they do for patients and their caregivers. Lisa Pahl is a certified advanced palliative hospice social worker. She's also the co-founder of the Death Deck and the End of Life Deck, which are card games designed to start those difficult discussions about dying and end of life. You can find Lisa and both the End of Life Deck and the Death Deck at thedeathdeck.com. In today's episode, Lisa and I are explaining who's on the hospice interdisciplinary team and the roles and the responsibility of each one. This is information that's going to help you understand what the team does and what you can expect from each of the members of the team. So keep listening for a great episode. There's a lot to learn. Lisa, welcome back to the podcast. I'm so glad to have you with me.
Oh, thanks for having me, Helen.
We're going to have your name and your title put with the company letterhead if you come back on the show so often. We'll have to double your pay.
I'm so happy to be back, Helen. I am honored that you've asked me to join you again today.
Well, we always have a good time, and it's going to be a good conversation. We're getting back to the basics today, talking about the interdisciplinary hospice team, which is a really important subject, but it can be confusing for people who are not working in healthcare. Healthcare is confusing enough as it is, so we're just going to try to make this one piece, this small piece, a little bit easier. Do you want to do an icebreaker question? We can do that today.
Sure.
Okay.
I'm always game.
So here's the icebreaker question for you for today. If you could be queen of the world, what 3 advisors would you choose? Have we done this one before?
Oh, no, we have not. 3 advisors?
Yes. So dead or alive, real or imaginary, sky's the limit. You get to decide.
Ooh. Okay. I would choose one being my grandma.
Oh, nice.
Because, she died only a few years ago, and I have missed her wisdom. I have missed her insights, and she had such an amazing sense of humor, but a great head on her shoulders. And so, if I am needing to run the world, I want someone that really can provide wisdom, but with humor. That's top importance for me. Now that's my touchy-feely answer.
Okay.
My other response would be Michelle Obama. I would love for her help in running the world and advising me on how to do that. And then I feel like I need to choose someone from end of life care, because I think that that's going to be my platform of what I want to improve in the world. So who do I want for that? There's so many amazing end of life speakers and practitioners. I think Sunita Puri or Shoshana Uslander. I think one of those women would be a great addition on my advisory board to improve end-of-life care, which is my platform that I'm now running on. Thank you, Helen, for this endorsement.
Lisa Pahl approves this message. I like that, though. That's a powerful group of people, and I love it that would be sort of your platform, is to promote end-of-life care. I would be on your advisory board. You're like not the governing board official, but you're call me when you want to brainstorm.
Oh, yeah.
Kind of board. I would totally do that with you.
Of course you would be on that board. And also, there's so many amazing, rich, qualified people that we could really make some change happen. So anyway, that's what we'll talk about after the podcast is
we will discuss that on air about how we can take over the world with that. I like it. All right, so we're getting down to business today. Mm-hmm. So let's get back to our topic for today. Now that we've goofed off a little bit, we're talking about the hospice interdisciplinary team. Because of time restrictions today, we're just going to be talking about the core hospice team. So we're talking about the hospice doctor or hospice medical director, the nurse, the social worker, and the chaplain or spiritual counselor is who we're going to be focused on today. So let's start with the role of the hospice doctor. And I was thinking, why don't I focus on the medical and nursing clinicians, and then we'll let you take the psychosocial and spiritual roles for the team. How does that sound?
That sounds great. I do think at the end we should talk very briefly about the home health aides and volunteers, because they are supplemental. They are, members of the team as well. So let's add a little bit about them at the end.
Awesome. Okay, so I'll start with the hospice doctor, officially known under regulatory terms as the hospice medical director. So each hospice agency has, as part of the core team, a physician. This physician should have training in hospice and palliative care. If you're really lucky, your hospice medical director is hospice and palliative care certified, which is really what you want to look for if you're hospice shopping. There's just an added hint there. But the role of the doctor is to oversee all of the medical care that's being provided. So if there's a medication that needs to be discussed or a symptom that needs to be managed, the hospice doctor is the go-to for those instructions, those orders, the medications that are going to be prescribed. The hospice physician is responsible for all of that. So to add in, it's also possible for the doctor that's been following a patient before they get admitted to hospice to become what we call an attending physician, which means they oversee the care of the hospice patient, which is great because it provides some continuity between the care that the patient was receiving before being on hospice and then the hospice care as it moves forward. An attending physician can do the same thing, prescribing, giving orders for wound care, coordinating the medical care, the healthcare part that's being provided. Physicians oftentimes do what we call face-to-face visits, where an in-person visit is made with a hospice patient, and that is all about recertifying, and this is all on the hospice agency to take care of, right? But the doctor actually makes an in-person visit to do an assessment, check out the patient to see if they still qualify to meet the requirements to stay on hospice. Not all hospices have their medical directors do those visits, but that can be part of the role of a hospice doctor. Anything you would add to that, Lisa?
I'm curious what your experience has been with how many people's physicians agree to be their attending and prescribe medications and remain really involved in their care. In my experience, it's very few physicians most physicians, it seems, would rather the hospice physicians follow the patient, perhaps because they don't necessarily have expertise in hospice and end-of-life medication management and that sort of thing. But I'm curious if that's your experience too, or if in your area you do see more attendings willing to continue on with the patient.
No, my experience has been the same as yours. I see very few attending physicians that want to continue on as an attending when a patient elects hospice care and moves forward that way. And I really do think it is because that's not their skill set. Mm-hmm. And to be honest, I've always thought that was a better choice for the patient because the hospice medical director is more adept and more skilled and hopefully has that hospice and palliative care certification. I think that makes a difference. But no, I don't typically see. It is allowed, and we do offer it. We ask the attending physician, especially if the patient says, "Can I keep my doctor?" Right. But I think more times they say no than they say yes.
Mm-hmm. And I think what you said is really important for people to hear because sometimes it can feel personal that the physician isn't going to follow the patient while they're on hospice care. And it's not personal. It really is about the expertise and the comfort level of the physician to be able to really provide what you need at that point. And so I think perhaps this can help people to understand maybe why their physician didn't follow them while on hospice, because it is the norm that it is typically the hospice physician that will follow.
Well, and I think when you look at the relationships that doctors have had with their patients, some of them have been treating these folks for years. Oncologists or neurologists for Alzheimer's and dementia and Parkinson's patients, nephrologists for end-stage renal patients that have been receiving dialysis. You know, these are doctors that have been caring for patients for a long time. Mm-hmm. And it's so nice to have somebody that already knows you, that knows your history, that could move forward with you. But if that's really not their skill set, it is better to understand that the hospice medical director is better suited to do the care. Mm-hmm. Yeah, but I do think those relationships, it's hard to forego those relationships with a physician that you've had for a long time.
Yeah, it is. It is. I mean, in some areas, I happen to work for a hospice where the medical director is the same person for palliative care and hospice. And so we can provide that continuity that earlier on in the disease process, the palliative care physician is meeting with the patient. And then later on, when they're on hospice, it's the same provider. But I do know that that's pretty rare. But and going back to your point, Helen, I think it's understandable that people hope that, these providers that have been caring for them and they have this relationship with, that they can continue while on hospice. But I have known quite a few, especially oncologists, who will welcome a phone call or a check-in. It doesn't necessarily mean that your relationship is over. They just aren't going to manage your hospice care. Sometimes there can be still a check-in or a conversation with a provider.
Sure. And I think that's important too, because it's a relationship, especially so when you're talking about an oncologist. A lot of times oncologists see patients from the very start of the diagnosis all the way through to when the hospice referral is made. So they form that relationship. I know as a home health nurse, there were times when I had patients that went on to hospice and I lost touch with them and I never knew what happened to them. And I always wondered, there was some completion of that relationship that I think I missed out on. So yeah, you really have to honor those relationships between an attending physician and a patient. But there has to be some acceptance of the realities of things. Attending physicians don't always choose to stay on, and that's just the way it rolls. Okay, let's talk about the hospice nurses, because we are awesome. We are hard-headed, protective, stubborn, but we're awesome.
You run the show.
We like to think we do. So when it comes to hospice nurses, and we're just going to talk about RNs for the moment, hospice nurses are part of this core team that's designated by regulation in hospice. RNs typically oversee the management of the patient, and we actually serve as what we call case managers a lot of times. And it doesn't have to be the nurse, a social worker, chaplain, anybody can act as a case manager. But a lot of times case management is run by the RN. So we are the ones doing the nursing visits, doing the physical assessments, providing the wound care, changing the catheters, monitoring the skin, all of those things like that. And the hospice nurse coordinates very, very closely with the physician to manage any symptoms like pain, shortness of breath, constipation, anxiety, those things like that, and gets all those instructions for medications from the doctor, sets all that up, makes it accessible to the patient, and gives instructions to the family. One of the biggest jobs the hospice nurse has is to coordinate with the social worker and the chaplain and the aide. And the reason that's so important is because we have our scope of what we do as nursing clinicians, but we also need to be able to look at a patient who is dealing with grief or depression or anxiety, or a caregiver that's dealing with those things, and say to the social worker, this family needs your skill set. Or say to the chaplain, this family is experiencing some guilt or regret or some existential questioning. They really need you to come and make a visit. So in my view, the nursing stuff, it's just all standard parts of the job, right? We do that all the time. But to be able to coordinate with a social worker and the chaplain to provide those other aspects and the more robust care, I think that's probably the biggest job we have as nurses. What would you add there when it comes to hospice nurses, Lisa?
Well, I think one of the things that people are surprised by sometimes with hospice is that they expect to see their physician more. They expect to see the hospice physician regularly. And that isn't the model for hospice and how it's set up. The nurse is really the eyes and ears for the hospice physician in most cases. Certainly, there are times when a physician visit is needed and will happen. But most of the time, the nurses are going to relay all of the important information to the physician, and then the physician is going to make those medication changes, and then the nurse is going to execute those changes by letting the family know, the doctor has increased this medication, like we talked about, this is what you're going to do now. So I think that what I hear often that family members talk about, though, is this confusion that they have over, I haven't even met the doctor and I don't even think they're on the case. And so, really trying to help explain that the nurses are communicating with the physician for every single change that occurs. Nurses cannot prescribe themselves. RNs cannot prescribe themselves. Obviously, a nurse practitioner, physician assistant can, but as we're talking about RNs, they do need the physician to be making the orders. And so the physicians are overseeing that management.
Right. You may not see the physician, but the nurse is the point person and is communicating frequently with the doctor to let them know what's going on, because none of those orders for wound care or any of those things happen unless a physician orders it. So that's a really good point.
Exactly.
So I don't want to leave out LVNs or LPNs because we do utilize those folks. They are some of the hardest working people when it comes to end-of-life care. They are the ones at the bedsides. They are the one teaching, providing comfort. And again, those LVNs or LPNs are coordinating directly back with the RN and talking with them. In my experience, LVNs that have been working in hospice, they are some of the most skilled people when it comes to providing bedside care for end of life. And so it's the LVN or LPN's job to report back everything to the RN. The RN communicates with the physician, and the LVN also will communicate with the social worker or chaplain as needed. So when you're seeing nurses, you may see an RN or an LVN. It just depends on what the schedule looks like and how their team is set up. I hope you're enjoying this episode. We're going to pause for just a minute. My guest has more to share.
This episode of the Heart of Hospice is sponsored by GrandPad. If you're looking for an easy solution to stay connected to your older loved ones, GrandPad is everything you need. The GrandPad is the all-in-one tablet designed especially for senior adults. The GrandPad utilizes a simple format that allows seniors to enjoy games, music, email, and more. GrandPad comes with 4G LTE cellular service already included, so there's no need for Wi-Fi. Users can create a private family network that allows for secure photo and video sharing. No spam, no robocalls. Only connections with those you trust. With GrandPad, you get safe, simple video calling and photo sharing to connect the whole family. The GrandPad is a great gift for a senior loved one on Mother's Day or Father's Day. This simple device empowers seniors of all ages and technological skills to safely connect with family, friends, and caregivers. The GrandPad team strives to create a world where no senior is lonely or isolated. To learn more about the advantages of GrandPad, visit our special GrandPad website designed exclusively for the Heart of Hospice listeners at grandpad.net/THOH or call 1-888-904-4723. That's 1-888-904-4723. When you need information about hospice for yourself or someone you care about, Hospice Navigation Services can help you navigate hospice care for the best end-of-life experience possible. If you're walking this journey and need the help of an experienced guide, Hospice Navigation Services is here for you. We understand the importance of having a guide who can provide personalized, unbiased support. Our team of experienced hospice navigators is here to offer one-on-one consulting sessions by phone or video. Whether you need information about how to start hospice services or guidance for your current services, we're here to listen and provide compassionate support every step of the way. You can book a 30-minute free navigation session with an experienced hospice navigator when you need general information to start your hospice experience. Book a 60-minute hospice navigation session when you have in-depth questions about hospice or need to troubleshoot your current hospice care. You deserve compassionate support and guidance for your end-of-life care. It's your journey. Hospice Navigation Services can be your guide. Visit theheartofhospice.com to schedule your hospice navigation session today.
Okay, social workers.
I mean, we're the true heroes on this team.
And oh, so humble. Oh, my God.
The social worker. So I have written a blog, What Does a Hospice Social Worker Do Anyway? And so I could talk about this topic for much too long. And so I will make it succinct as possible. The thing that I love most about hospice is that it is patient and family driven. And so really, as a social worker or a chaplain, we are meant to be chameleons who will provide the services that that particular patient and family needs. So sometimes that's resource management, helping connect with caregiving agencies, coming up with caregiving plans, helping facilitate placements, talking about funeral arrangements, providing assistance with Family Medical Leave Act paperwork or disability paperwork. So we do a lot of tasks for those who need that. And then we also provide emotional support, anticipatory grief support. We facilitate conversations with family members and really help with some of those dynamics. We assess for depression and suicide risk. We help understand the psychosocial dynamics that might be impacting care and impacting symptom management. And then we try to assist with alleviating some of that. I think most social workers, there are different perspectives of social workers and different things that they're most skilled at. Some of the social workers I work with are super resource savvy, and they are really, they approach with a resource front of mind. Other social workers approach with the emotional support and an anticipatory grief component first, and then kind of work on resources as they are needed. So it is meant to be that we provide what you need for the patient and family. And my favorite aspect of social work is really supporting the patient and family system emotionally. I spend a lot of time with the caregivers, the people providing care, and that can take place in the home, that can be phone calls, that can be at a coffee shop away from the patient, so that we can really dive into what this experience is like and give them space to talk about their feelings, and prepare for the future. So I can go on, but I think I need to pause and say, anything to add, Helen?
I mean, we could go on because the social workers really do provide such a wide range of assistance when it comes to the care of our patients. You know what strikes me is family conferences. Mm-hmm. Social workers typically coordinate that when we have a family that needs to have a group conversation. And most of the times we don't do that because everybody feels like holding hands and saying, I love you and you're pretty. They're doing it because there is conflict or there's a big decision to be made. And we're talking about really hard topics that are very grief heavy. So social workers typically lead those, and the nurse can be involved, and the chaplain can be involved as well. It's a big project to have a family conference. So social workers, in my experience, are responsible for coordinating that and having those conversations. And I've always been really grateful for the, I guess, like mediation skills. Yeah, a social worker is a mediator and a communicator.
Yes.
Definitely. Yeah, a diffuser, all of those things.
Yes, most social workers working in hospice are master level clinicians who have received training in family theory and dynamics and how to facilitate these conversations. And so I I do think that it is incredibly helpful when the RNs really utilize the social workers for their communication skills. I think sometimes RNs or the nurse may feel like they need to resolve things and they get frustrated with the family and they're not telling the social worker. So I really like, Helen, how you've framed it as, when these issues arise, call your social worker. And for the family too, if you aren't seeing your social worker, um, we do vary our frequency. And so it is supposed to be meant by or determined by need. Um, and so we may not exactly know that you need more support unless someone tells us. And so you can tell the nurse, or you can reach out to the hospice provider or the social worker directly and ask for a visit or a phone call if you're experiencing anticipatory grief or family dynamics or just want someone to talk to.
Yeah. Yeah. The need for each of the disciplines can change, can ebb and flow. And I think that's a really good point. But yeah, the nurse, we do have a tendency to want to fix everything. We do. So many times, you don't want to leave the home until you've talked about all the stuff you think they might need. And the fact of the matter is we have an interdisciplinary team because no one discipline can manage the care of mind, body, and spirit of a patient and caregivers by themselves. You've got to have the other people. It's super important. So social workers are our superheroes, let's face it. You guys are the problem solvers. It's amazing. I learn from the social workers that I have worked with. Patients' rights, legal things, just an amazing resource. All right, so now we're going to talk about chaplains. We don't even know what those guys do. Sometimes I don't think I even know what these guys do, but they do bring a very, very special aspect to the care of people who are dealing with serious illness and end-of-life issues. So I'm going to let you tackle this one to get us started.
Well, going back to what I said about social workers, the chaplains are meant to provide support in the way that the patient and family wants support provided. And so they are typically the experts on spiritual issues and existential issues. And so if a patient is having concerns about or talking about their regrets, talking about concerns about what's going to happen after they die, these are topics that a chaplain is so skilled in facilitating these conversations. Chaplains can also provide specific tasks like prayer or connecting with a priest, a Catholic priest, for anointing of the sick services, or they can also connect with the local pastor of the church that the patient's been attending. So they can provide that specific religious professionals to come on in, or they can also provide prayer for the patient or family if that is what they want. I see a lot of my patients actually, they say, I don't want the chaplain to come, but then the daughter does. And so the chaplain is there to support the whole family system, like we all are. And so, it doesn't have to be patient driven. It can be family driven. And that can look like a phone call. If the patient doesn't want the chaplain coming to the home, that can be a phone call. That can be meeting outside of the home setting as well. So the chaplain's really there to provide that spiritual support. I do see our roles as kind of overlapping at times because we're both there supporting the patient's emotional and spiritual and psychological well-being. Again, the chaplains are focusing more on the spiritual, but they're going to give some emotional support and compassionate care as well. And then the social workers are focusing mostly on emotional support and grief. But we listen and we engage in conversations about spirituality when they arise. We just also then let the chaplain know so they can go a little deeper next time.
Absolutely. So one of the reasons I think people refuse to have the chaplain out is, first of all, they don't know what the chaplain does really, right? Or they think that the chaplain is there to convert them to a certain belief. I think most of the time, because of mainstream Christianity, that's what they expect from a chaplain. But it's important for people to remember that a chaplain is going to provide care for whatever spiritual beliefs you might happen to have. They may be religious based or they may not be. And we do also have patients and families that are humanist or agnostic, atheist, Wiccan. And a chaplain is trained to provide spiritual care, spiritual support, and counseling for any of those religions. So your chaplain may have a personal belief system for themselves that's religious or spiritual, but they are not going to, or they should not, attempt to change the patient's or the caregiver's belief system. And I hope people hear that. Say it louder for the folks in the back.
That's an important aspect. The chaplain is not there to try to push their beliefs or convert anyone to their religion. If that is happening, that is an opportunity to let the hospice manager know, because that is not the intended role of the chaplain and within hospice. I think the other reason that people don't let the chaplain come out is that they think that that's meant to be when the patient is really close to death. They think, oh, we're not ready for the chaplain yet. I hear that a lot too.
Right.
And so, as you talked about the RN role, I do really see the RN as also helping to explain the role of the team members and kind of get the buy-in and say, the chaplains are not just there for the very end. They're meant to accompany you and support you in your spiritual self along this journey, not just at the end. But in a hospital system, the chaplain is often called in, in dire situations or after a death. And so I think it just also is just about our healthcare system maybe changing how that's viewed, because it's hard for people to come from that model of chaplaincy to the hospice model.
Yeah, hospice just looks different. You can have the chaplain from the very beginning. So that's the core team, those 4 members. But we also wanted to include a little bit of discussion about
the home health aide.
Yes. They do call them home health aides, but I like hospice aide. It's the same thing, a nurse's aide, nursing aide, and volunteers, volunteer coordinator. So an aide works under the supervision of the RN. That's a regulatory component. They get their instructions about what to do for the patient from the RN. And the aides, these are the workhorses of our team. These are the people that have the most intimate, most frequent visits and most intimate relationships with our patients. They are the ones providing personal care. Sometimes it's just a standby assist for a shower. Sometimes it's a complete bed bath for a patient who can't do any of their own care. But those aids are cleaning, dressing, bathing, shampooing, always checking the skin and reporting back to the RN. And they are changing linens on a regular basis and providing that extra set of eyes and ears in the home, asking the patient and the family, have there been any changes? Are there any symptoms, any pain? And reporting that back to the nurse. Those aides are some of the most remarkable people that I know.
Yeah, they are, and I think that's it's good that we're talking about them. I have hospice aides that I work with that are just light up the room when they come in. And, I'm thinking of one in particular, and everyone describes her as sunshine walking in the room. And she's providing, it is manual labor bathing someone that is bedbound, and it is a really hard job. And so, as Helen mentioned, I think that your aide might be the person that you feel most comfortable actually confiding some things in, because you are so vulnerable in this type of personal care. And so I get a lot of social work updates and referrals from the aides as well, who let me know, this came up when I was bathing, Mr. So-and-so today, and maybe you want to follow up next week and talk with him and kind of further that conversation. So, the aides, they provide such value, and I can't tell you how many times patients have told me, oh, it felt so good to get a bath.
Yeah. So being clean is part of being comfortable.
Oh, it's really important.
Absolutely.
It's really important.
Absolutely. Yeah. And I patients just fall in love with their aides, and it's reciprocated. Aides care about their patients and love them. They're just an amazing group of people. Okay, so volunteers and volunteer coordinators. Let's talk about that part of the hospice team. It's rather unique.
Yeah, I think we could even do a whole episode on this, so I think we should be pretty brief. The volunteers are there. They can provide respite for patients, meaning the wife is the primary caregiver and she needs to run to the store. There may be a volunteer available for 1 to 2 hours to sit with the patient while his wife runs to the store. The volunteers also can sometimes provide companionship, socialization, or sit with a dying patient, depending on the availability and skill set of the volunteers. And the volunteer coordinator is the person who organizes and trains and updates and make sure the plan of care is addressed, so that we all know if a patient has a volunteer. And I try to communicate with our volunteers, and we try to have a communication, because just like the hospice aides, they have a different relationship than I do with the patient. And so sometimes some issues will arise for me to follow up on. But the volunteers, they are volunteers. They are giving their time. They are doing this out of a desire to help people. And so I greatly appreciate the volunteers. And of course, there is a regulatory issue involving volunteers where hospice requires Medicare certified hospices have to have a percentage of their work hours be matched by volunteer hours. And so they are a really important member of the team for lots of reasons.
Right. And those volunteers are not doing it because they want to help the agency meet the hospice regulations.
No, they do not care about that.
No, they are doing it because they are generous and compassionate, and they have a heart for the work that we do. Sometimes it's not easy for our volunteers. They lose patients as well. So I think we did pretty well. I think we probably could have taken 3 hours to talk about the different disciplines, but that's sort of an overview of everybody. Mm-hmm. So I think that would be a good episode to have to talk about volunteers.
Let's do it.
All right. Well, Lisa, Pahl, thanks again for being with me. Where can people go to find you and purchase a copy of the Death Deck or the End of Life Deck?
You can find me at thedeathdeck.com. You can also email me at lisa@thedeathdeck.com.
Awesome. Thanks again for being with me.
Thanks for having me.
Thanks for listening to the Heart of Hospice podcast. Check out our sponsor in the show notes and please leave a rating and review on Apple Podcasts. We would appreciate it if you would share this episode with your friends and family and anyone who needs to know more about hospice. Connect with us on Facebook, Instagram, and LinkedIn. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.